Welcome to GovCast. I am your host, Managing Editor Amy Kluber. In addition to the Department of Veterans Affairs' missions of veterans healthcare, veterans benefits, and national cemeteries is one that many Americans might not realize exists, that it serves as a backup health system during a crisis or other national emergency when civilian hospitals might overflow. That function is what the VA calls its fourth mission. The agency activated this function April 14th in response to a national call for help for Americans during the COVID-19 outbreak. It offered a number of beds available for FEMA, care for civilian patients, and for those in nursing homes, and reaching patients wherever they live. Part of this effort includes many tech advancements like telehealth. We spoke to CIO Jim Gfrerer on this incredible mission and how it's impacting the information and technology at the agency moving forward. Thank you to our sponsors, Dell Technologies and 4 Points Technology.
Hello, I'm Maheen Mirza, Sales Director, Federal Healthcare at Dell Technologies. IT leaders in the federal government are increasingly raising issues of infrastructure, legacy communication systems, automation needs, and more, and Dell is listening and acting. As a trusted technology partner of the Department of Veteran Affairs, Dell has worked with CIO Jim Gfrerer and other VA leadership to support their mission. During this time of the pandemic, Dell works closely with the leadership at VA on expanding their telehealth and telework capabilities to ensure support of their fourth mission of being the nation's backup healthcare system. This project, which included workforce infrastructure, software, and services, allowed VA employees to rapidly transition and continue operations through remote capability. We're excited to hear from Mr. Gfrerer during this unique time when the VA's fourth mission is put on display.
VA has been at the heart of much of the national response to the current pandemic, its fourth mission having come into focus, especially in terms of what that means for technology. So, Jim, thank you for talking with me today about this incredible mission.
Absolutely. My pleasure.
So what are the core tenets of the VA's fourth mission, and how do they apply to this pandemic?
Sure. The core tenets are really around the fourth mission. In times of national emergency, as the president declared on March 13th, the VA is expected to become the national healthcare system of record. As you probably know, we are the largest integrated healthcare system in the country, approximately 172 medical centers, about 1,200 community-based outpatient clinics in every state. And so with that kind of market penetration and exposure across the country and presence, we're really well positioned. On any given day, we're serving about 9.5 million veterans, but there's some additional capacity that can be brought to bear. So that's really the constitutional and the national emergency premise around the fourth mission, is that we would be prepared to assist. And you can see that as it's been done, especially in the Northeast, in some of the state homes, the state veteran homes, where VA staff, principally Veterans Health Administration staff, have assisted in a number of ways, all the way from testing to with PPE and other kind of services. And then on the reciprocal side too, the VA and VHA principally, again, has taken in civilian patients into our VA medical centers. Not a lot, but again, some. And we're certainly well postured with Dr. Stone and his team's leadership to make sure that they could expand to the maximum extent as required.
What distinct assets does the VA provide the nation during times like this?
Sure. So it's, you really want to look at our mission essential functions. And of course, the principal one is, especially in a pandemic, is providing that healthcare. But there also are two other mission essential functions around veterans benefits and providing that support. And then also as national cemeteries, providing burial, interment, and other types of mortuary support. So again, we have that presence in every state around major and minor areas. And so it's really the totality of that. There's no other federal agency and no other real commercial entity that has that presence.
It's certainly a profound presence. And in addition to that, how is the VA adapting its technical capacities to best serve veterans during this time?
Sure. So again, I think as we entered the pandemic, we were reminded that the definition of a black swan event, right? And certainly a once in a century event is something that, some people in their entire lifetime will never see, hopefully not see more than once. And, the definition of the black swan event is that nothing in your prior experience, professionally and personally, has really fully prepared you to address the challenges of the black swan event, in this case, the coronavirus pandemic. When we certainly in the VA, like any other federal agency, exercise and prepare for continuity of operation events. This one, again, had a really unique twist in terms of, the shelter in place and the, substantial remote access of our workforce and our customer/patient base. So when you look at those kind of unique circumstances, information technology and technology as a whole really was the savior for this. The ability to, in the case of the VA, triple our remote workforce and be able to leverage that within a matter of less than a few weeks. The ability to really go from a largely on-premise delivery of services in terms of healthcare to having now, on any given day, there's about 20,000+ telehealth appointments that go on. And so again, almost 400,000 every month or more. So, and then certainly delivery of services, right? You find veterans that maybe were not as digitally attuned, and now they have to do things in terms of their customer experience that's more on va.gov or using My Healthy Vet for prescriptions. So it's really forced everyone to rapidly move to those digital channels. And then for VA and certainly for the Office of Information and Technology, for us to undergird that. And this is probably a good point for me to kind of make, the point, and I have to remind folks, even in our own office occasionally, it's the Office of Information and Technology, not the Office of Information Technology. And the reason I always point out that distinction is there's a large part, a growing portion of our portfolio where we are delivering information as a service. So an example that would be the national surveillance tool that we're supporting with VHA so they can track all their relevant healthcare metrics across the entire network. That is all undergirded and supported by our business intelligence services line and using our corporate data warehouse. Certainly our digital experience product office run by our CTO, and everything that we're doing on va.gov and all the other kind of digital direct to patients, whether it be chatbots to answer questions and allow patients to self-serve on that information. But again, a big portion of ours is not just delivering the infrastructure and supporting remote access and telehealth, but it's also on that information component and the delivery of those digital services and channels.
That's a great point, and I'm not sure many people understand that, so I'm glad you brought that up. As far as some of the challenges that you just mentioned, how are veterans adapting to and using some of the technologies like those that are being used in telehealth services?
Yeah, it's a great question, Amy. There's kind of a perception out there that we have certainly a large portion of our veteran population is an older, I'd say, 60 or older. They want to be as connected as the younger crowd, right? And one of my favorite pictures is I was standing in line last year at Reagan National to catch a flight, and here is a 94-year-old World War II Normandy veteran. He was a soldier, and he's in his wheelchair waiting to pre-board with his wife, and there's a smartphone in his hand that he is accessing and manipulating, 94 years old. So, we realize that even our older veterans, especially in some cases our older veterans, they like mobile. We're moving rapidly to mobile platforms and applications. We're certainly doubling down on all of our web-based applications as well. So we're working every conceivable channel in the digital space to meet the veteran where they want to be. Again, information and technology, anywhere to anywhere, anytime.
Are there any plans to further expand the telehealth capacities?
Yes, as I mentioned, right now, we're probably delivering about 400,000 appointments a month. We just began with our vendors and the telehealth team a pretty substantial replatforming into a cloud infrastructure. Again, that's another one of the success stories of VA and the pandemic is like a number of federal agencies, although I think we're kind of a leading agency in terms of cloud migration, given the substantial investments and kind of smarts, if you will, that we've done in cloud migration over the past 2 years, we are able now to kind of confidently and with a good playbook take the applications, for example, the commercial applications that our VHA telehealth team was using, work with the vendor, work with the telehealth team and say, listen, we understand the constraints of the on-premise tool at our data centers and at the TIC gateways. We know that if we're going to meet and exceed the capacity, and one of the watch phrases for OIT throughout this has been staying ahead of demand. Right. So we always want to make sure that there isn't that latency or performance degradation or that we are some sort of constraint on any of the business lines. And, I can proudly say for our team that throughout, whether it be remote, telehealth, the digital experience, we have stayed ahead of demand. We will always stay ahead of demand. Now, on the flip side of that, the great advantage of the cloud is as we continue our migration to that environment and supplement, our capacity there, we have the ability, as you know, and your listeners know, to scale up and down very quickly, right? And so it's not like in an on-premise environment where we remake all the necessary infrastructure upgrades and then you bought it, you own it, right? It's much more temporal in the cloud environment, and it allows you to scale up and down fast as the customer demands dictate.
Certainly sounds like you are ahead of the curve. And some of the things that have also been coming into focus during this pandemic is 3D printing. How has the VA been able to leverage its existing 3D printing network to produce some of that equipment that it's providing?
Sure. Yeah. And I think you've seen that worldwide, that there's, I would say that, we're probably at the end of the beginning, right, of 3D printing, at least in our environment. And again, it's principally around Veterans Health Administration. And, there's a couple areas, right, in terms of the business proposition. Number one, it really is more for biomedical purposes, right? So they're printing off, in some cases, swabs for testing, some replacement parts for certain devices. There's certain valves and whatever on ventilators and other, devices which can be replicated. So it's principally, going to be for that. Again, while 3D printing is not new, and the VA has certainly been an innovator and Veterans Health Administration in this space, we're just now starting to fully realize, what the possibilities are for that. And OIT's role is really to make sure that as those devices are, fully developed and deployed, of course, they're going to be networked. We need to make sure they have the security and the support and the sustainment going forward so that they can continue to produce the things that the biomedical community is going to want from them.
In terms of data analytics and sharing some of that information, how has the VA used it to track the course of the pandemic and inform the leadership on the status of the local hospitals?
Yeah, no, and that gets back to, again, our business intelligence service line and their partnership with Veterans Health Administration. Early on, the leadership at VHA came to us and said, we really need you to support this. The data that we are able to extract from the corporate data warehouse, and again, those various metrics across the medical centers, gave that single source of truth to leadership in DC and also across the entire network so that they could make best decisions about, especially in the early days, right? What was their ventilator supply and usage rate? Certainly as the pandemic wore on, the real critical metrics were around personal protective equipment. And even to this day on the VHA Healthcare Operations Center calls, that's kind of a center point is, what types of PPE and how many days of supply do they have on hand? And so, again, it's given that single source of truth. It's done it in a very responsive and transparent way, a way that in the past was really relegated more to aggregating data from, kind of asynchronous reporting on a daily basis. So it's really leveraged the power of our corporate data warehouse. I would tell you, too, that on a non-business side and on a non-clinical side in terms of analytics, the other star on the technology side is our group within IT operations that does performance monitoring continues to build out our suite of analytics that looks at every day the performance of critical applications and systems. And I know, for example, on telehealth, There have been a number of times where these analytics have been monitoring the performance both on-premise and in the cloud, and they have signaled ahead of time where configurations were probably going to be needed, load balancing in most cases, to make sure that we were avoiding latency or avoiding outages, right? So again, not just staying ahead of demand, but staying ahead of performance too, right? And every system at some point kind of reaches critical mass, and so you want that analytical capability to be monitoring the systems and make sure that you're making the right configurations so you're not degrading the system performance. So on a technology side too, the analytics have really proven, at some point it's already become table stakes, but we're having to go back across our entire portfolio of about 800 systems and applications, and on a priority basis, make sure that we get monitoring on each and every one of those for the reasons I just laid out, like in the telehealth example.
Looking back over the past few months, has the VA's experience in adapting to the pandemic and VA's response informed how the agency might respond to future outbreaks?
Well, certainly. I mean, there's nothing like a real world event to kind of focus the mind and for people to take it seriously, right? We, as any federal agency, prior to this, we were focused annually around our Eagle Horizon exercise series. And again, looking at both man-made and natural threats, and then the various ways we would respond to certain world events. This one certainly focused us a lot more keenly and a lot more from a length standpoint. I mean, you would never, even in a couple of week exercise, be able to derive all the progress and experience that we've gotten out of this. When you look too at what we've done, what we're able to provision and do, it's certainly postured the department in a much better sense for any number of contingencies going forward. The other thing too is I think our partnership with the administrations, with VHA, with Veteran Benefits, and with the National Cemetery, even early on, we were stress testing at our trusted internet connections at our 4 gateways to get a true measure of what our capacity was to support a remote workforce. And then, what additional enhancements and improvements we need to make in order to shore that up and expand. Our business partners, the admins, were very patient with us over the series of almost 10 days as we really took the unusual step of stress testing our network. Here's an operational network that's in production that has real business traffic flowing back and forth. And we were, again, doing things to it to see where the limitations were. It was creating, some temporary challenges, but our business partners understood, hey, we needed to do that, right? And out of that came the enhancements and the increases that we're able to provide over the subsequent weeks.
And 10 days really isn't that long, all considering.
No, and we were, and truth be told too, we were very responsive about it, right? At the point that, and really not to get into too much detail, but essentially we had about 40,000 people pre-COVID that were remote access, and each one of the gateways could handle about right up to that limit. So at the point that we were pushing all the traffic through one gateway to stress test that lone gateway for the day or the multiple days, as we saw the degradation in service and the latency, we would bring on another gateway. It wasn't like they were out of business for a given day.
Do you see any of these efforts impacting or shaping some of your tech priorities in the future?
Of course. Yeah. I mean, I think the big one for us is that whole direct to the veteran and that customer experience portion. Again, our CTO, Charles Worthington, and his digital experience team lead that. Certainly, again, Jack Bates and the business intelligence service line. We're going to have to reinforce and continue on that. I think, while we're doing a lot of good work, here's a recent example. So as part of the social distancing now at some of the VA medical centers, one of the VA medical centers, I believe was in Durham, came up with the idea of having essentially a virtual waiting room so that, almost when you go to some fast food restaurants, you can click a button and you can say, I'm here, and essentially check in, whether it's for delivery of fast food. We can do the same thing for healthcare. You can say, hey, I'm in the parking lot, I'm here. And then, the medical centers are building a system around that where they can maintain that safety of clinicians and patients, maintain social distancing. But again, technology is enabling that. So that's something that's literally happening as we're talking. That's an application that's being developed and enhanced, and it's going to go from one VA medical center to a nationwide solution probably in a matter of weeks, like a couple of weeks. So, these are all capabilities that our team is able to work with VHA to deliver. And then I think it just becomes a matter of, as we come out of the pandemic, we take stock of what we've done. I'm sure there will be some more ideas on what hasn't been done or what could be done, and certainly probably circling back and probably standardizing that environment a little more around all these connected care applications, making sure that they're sustained. So I think we're going to see that ecosystem, kind of get disciplined and consolidated a little bit. And quite certainly there'll be some additional work that we'll have to follow up on coming out of it.
Well, Jim, this was certainly fascinating. This is all incredibly important work, and I'm glad to have gotten some more context to everything that we've been seeing over the past few months. And so thanks for talking with me.
Absolutely, Amy. Thank you. And it's our pleasure. We wake up every single day at Office of Information and Technology thinking, how do we support our business lines? And as importantly, how do we help them to support and enable on the right channels the 9.5+ million veterans that utilize VA services every day?
Thanks again to our sponsors, Dell Technologies and 4 Points Technology.
I'm Denise Harrison, Chief Information Officer at 4 Points Technology. As a service-disabled, veteran-owned small business, we at 4 Points are especially proud to be partnering with Dell Technologies on important initiatives with our government partners like the VA. We look forward to continuing to support the critical missions of these agencies and being part of more conversations about the impacts of IT modernization within the federal government. For more information about how we are working with the agencies like the U.S. Department of Veterans Affairs, visit us at www.4points.com. That's the number 4, POINTS.com.
GovCast is a production of Government CIO Media and Research. For more podcasts, head to governmentcio.com/podcasts. If you liked what you hear, let us know by leaving us a review in iTunes or wherever you listen to podcasts. GovCast is produced by Amy Kluber. Theme music provided by Big Hoax. If you're interested in sponsoring a podcast, contact us at sponsor@governmentcio.com.